You're listening to the O&P Check-in, an SPS podcast.
This podcast brings you the latest happenings in the O&P industry. We're unpacking trends and news from this tight-knit orthotics and prosthetics community.
Yeah, and thanks for joining us. My name is Brendan Erickson, Regional Sales Manager here at SPS.
And I am Jacki Green, and I'm a Marketing Specialist at SPS.
Let's get started.
Take your orthotic practice to the next level with the triple action from Becker Orthopedic. The triple action is designed to minimize restriction of the ankle while providing maximum therapeutic benefit to the patient. Contact your SPS sales account manager today to learn how our clinical and technical support team can help you validate, design, and fit a triple action AFO to your next patient. Now let's see what's happening at SPS.
Well, this is a new update. Jacki, I don't know, you've probably heard College Park has a new foot out, the Voyager. It's a vertical shock foot, and there's a bunch of new unique aspects that you may not be familiar with.
Yes, there are. So we have a new episode of the Clinical Minute done by SPS Clinical Education Manager Sam Roulette, who has been on this show. And he meets up with Clinical Education and Tech Services Manager John Cook. And they go over all of the foot's unique design and adjustable torsion units, and they cover all the stuff about the new College Park, the Voyager.
Yes, awesome. Shout out to the Clinical Minute. To watch or to read their conversations, visit the SPS blog, or you can follow the link in the description. Okay, let's get this interview started. We're thrilled to be joined by the American Orthotic and Prosthetic Association's Advocacy team today. Welcome, everybody. Before we get started, do you think each of you could share a little bit about yourselves? And how about, Ashley, we start with you?
Yeah, absolutely. My name is Ashley White. I'm the Director of Health Policy and Strategic Alliances at the American Orthotic and Prosthetic Association. I've been with the organization for about 6 years, and I oversee our advocacy as well as our research departments.
Hi, everybody. I'm Joy Burwell. I'm the Director of Communications and Membership. Been with AOPA for about 3 years and love doing everything that I get to do. I get to talk to a lot of exciting people in our membership and in the profession. And then with the membership side of things, get to help make the next step for the profession. So yeah, I'm glad to be here today.
Hi, everyone. My name is Nicole. I'm AOPA's Manager of Public Engagement, and I've been here now for 5 months. So relatively new and excited to be part of the AOPA team, but I am not new to the orthotic and prosthetic world. I'm actually a prosthesis user myself for the past 20 years. I lost my leg to bone cancer when I was 10 years old. So this work is really important to me, and especially the work that we do from an advocacy and policy side to help ensure patients have better access. So really excited to be here with all of you guys today.
Hi, everyone. My name is Joe McTurnan. I'm the Director of Coding and Reimbursement, Education and Programming here at AOPA. I've been on the staff at AOPA for about 18 years now, and I work very closely with Ashley in the Advocacy Department, taking the great work that they do and turning that into real policy and impacting policy and regulation through the great work that they do on the advocacy side.
Hi, everybody. My name's Sam Miller, and I am AOPA's State and Federal Advocacy Manager. It's really exciting to be here. I've been at AOPA for coming on a year now, so relatively new, but relatively, have a little bit of experience. A little bit new to O&P, but really love advocating for our patients, and it's really nice to be a part of the team.
Well, thank you, everyone, for being here with us today. This is super exciting. We haven't done a podcast with this many people before, so this is really fun on our side. So, okay. On to some fun questions. So a big focus for your team is the Medicare O&P Patient-Centered Care Act, which was introduced in the House in March of 2021, as I'm sure you all know, and in the Senate in July of 2021. So for listeners who might be a little bit unfamiliar with the legislation side of things, could you talk about what this is, what's going on? It's been over a year for the House and almost a year for the Senate.
Yeah, so I'll start and then I'll defer to some of the members on the team for a little more color. But the bill is actually the second Congress it's been introduced. So it was also introduced in the 116th. As you all know, Congress runs on 2-year cycles. And so we're approaching the end of the second year of our second cycle with this bill. We have been able to garner a lot of support. We've got great momentum behind the bill now. It has 4 provisions. All 4 of those provisions are focused on protecting and preserving patients' access to the care that's provided by prosthetists and orthotists in the provision of prostheses and orthoses. And so it really is truly a patient-centered care act in that way. In the past, AOPA's had great success in building champions on Capitol Hill and making sure that those relationships are established. And so we've got some really strong members of Congress that are supporting us in getting this legislation across the finish line this year. The first provision of the bill is an administrative distinction between the DME, off-the-shelf nature of durable medical equipment and the care-oriented nature of prosthetic and orthotic care. So it creates a subset of orthoses and prostheses, pulls them out of the list of medical supplies that currently exist in the Social Security Act where orthotics and prosthetics are defined. So it literally creates its own subcategory, and that way we can define the care that's associated with the delivery of those devices so that we protect it for Medicare beneficiaries to continue having access to it.
Yeah, I think that's awesome. And one point that makes me kind of understand that a little better is the time concept, right? Our prosthetists and orthotists out there are providing these products not for one day at a time in a snapshot. Hey, I'll see you later. This is 3 years to 5 years of service and patient care that is all included in a one-time, provision of those products. So for me, the timeline makes that, kind of more understandable.
Yeah, and we often share some real world scenarios here, and would be like if a proposed rule comes out from Medicare, we often have to start some paragraph with, unlike diabetic test strips or unlike oxygen tanks, the prosthetist spends, this much time with a patient in the provision of, and I mean, that is the kind of things that we actually have to write in our comment letters, because when regulation is passed, it is for the entire durable medical equipment space. And so we often find ourselves caught up in that. And that's accurate, right, Joe?
Yeah, I mean, ironically, the reason why we're in this situation where we are just kind of naturally wrapped up with durable medical equipment as far as kind of all lumped into one category really doesn't have anything to do with the fact that orthotics and prosthetics are even similar to DME traditionally. It just so happens that 30, 40 years ago, when Medicare decided how they were going to process claims for orthoses and prostheses, there wasn't enough volume to train all of the state-based Medicare carriers to individually process those claims on a state-based level. So what they had is they had these 4 regional durable medical equipment carriers that were already established for DME. And CMS at the time made the decision that, hey, we only have to train 4 contractors to process these claims, and they can handle the volume that these claims represent. So we're just going to include orthotics and prosthetics in the scope of the claims processing for the durable medical equipment regional contractors. And so really a matter of convenience over 40 years has turned into just an assumption that we're the same. And so, now we're trying to reverse that legislatively because of all the consequences that have happened over the years and all of the misunderstandings that have happened over the years that have kind of lumped O&P together with durable medical equipment.
And how's it going? I mean, what is the success that you guys are seeing out there?
Well, I know that we'll probably be talking about the policy forum a little later, but we have more momentum in this Congress than we've ever had for any piece of legislation that AOPA has introduced. And I think that's because there's a recognition that these are real world policy issues that are affecting patients' access. And so members of Congress see this as an opportunity to do something good. It's bipartisan, bicameral, non-controversial. It really hits a lot of the a lot of the check boxes that members of Congress are looking for when they go and say they're going to provide their support or put their name behind something like this. So the other three provisions of the bill are super technical and related to competitive bidding, competitive acquisition, but they all, again, protect patients' access to the care that's being provided. So return to the congressional intent of what is defined as an off-the-shelf device to one that can be put on the patient themselves. That's just common sense, right? We don't want devices being delivered off the shelf if they need clinical oversight and patients don't have access to it. So it's that kind of thing that really resonates with members of Congress because they see how this impacts their patients directly.
I think that this bill is really special because it protects patients and it helps patients have more access to care, but at the same time, it also saves the Medicare system money. And that's not something that's that common with legislation that deals with healthcare. So there's really something for everybody. We'll talk about this more with Policy Forum, but we've been adding co-sponsors directly due to that event. And it's been really helpful to see that it's coming from both sides of the aisle. There's something there for everybody.
So you guys both each mentioned the Policy Forum that was just convened in May, correct? Can you guys give us an overview of what happened there, and from your perspective, how did it go? How many co-signers? What kind of success can we hang our hats on?
So I just checked this morning, and we're at 27 total in the House for both co-sponsors and original sponsors, and I believe 6 of those are directly in the weeks following Policy Forum. So there's definitely like a measurable amount of success from the meetings that we were able to have at the event.
We have 7 co-sponsors in the Senate, which we were able to come out really strong with 6 senators supporting at introduction. So the Senate is harder to get co-sponsorship of bills. That's just natural. There's less of them. They have more things to focus on, and they tend to be in the news a lot more. But it's good to have that strong number, particularly because the senators that we have supporting us are the committees of jurisdiction, senators that serve on the committees of jurisdiction for the bill.
I guess you guys mentioned 27 co-signers and 7 co-signers, right? Do you guys have specific goals, and how close are we getting there? Is there anything we can do as the O&P industry to help you out?
Sure, yeah, and I won't pretend to talk about the mechanics of getting more co-signers. I know Ashley and Sam are directing me on that front. But yeah, AOPA, back in March of this year, we refreshed our brand, and including a new vision and mission, a new logo, and really kind of wanted AOPA members to see themselves in that logo, vision, mission, including our advocacy efforts. AOPA prides itself on being a great advocate, not only for our members, but the profession. And what we've been doing is really making to show, not just tell, the work we're doing. And so with that, on the advocacy front, we've launched a series of webinars called AOPA Advocacy in Action. And we really, each month, Ashley, Nicole, Sam, whoever from the team comes on and talks about a specific part of our advocacy efforts and how our members can get involved and what they can do. And we encourage engagement from that front. We also keep them regularly updated through AOPA's co-op. We're constantly making sure that not just at the federal level, but members have information about what's going on in their state so they can stay engaged and up to date on what they can be doing to move the needle in their own states. So, I think hopefully we've created we've created an engaged group of advocates, seeing them at the Policy Forum and seeing the follow-up that's been happening in the subsequent month. I think we have a really good chance of getting them and continuing to get them involved as we get this legislation over the finish line. But yeah, I think we really hope that members and the profession are seeing themselves in AOPA, and therefore, we'll see some success at the end of this.
And Nicole, we've also taken the opportunity to change the way we look at our advocacy and our opportunity to bring AOPA members and patients to the Hill. And so Nicole was part of an effort where we took the whole team in April and advocated on behalf of a patient, but we were able to bring in the Medicare O&P Patient-Centered Care Act. Nicole, would you talk a little bit about that experience?
Yeah, definitely. So, I mean, with my background of being a prosthetic user myself, I'm well connected in the amputee community and have done some advocacy work of my own in terms of getting access to what I've needed to live an active life. And through that process, I actually got connected to an individual in the state of Washington, which is where I live. Her name's Hannah Van Kara. And she is still trying to become the first individual to join the Navy as a nurse, as an amputee. And but unfortunately, current policies limit someone who's an amputee from joining the Navy unless you're already on active duty and lose a limb that way. And so I got connected with Hannah, got on the phone with her, started to understand what her story was and what she was fighting for, and immediately wanted to help and figure out a way that we could help bring her story to members of Congress to uplift her voice and see if there could be a pathway forward of changing this policy that really limits amputees from joining the military and for her specifically in joining the Navy. And so in April, we got together with Hannah and also her prosthetist, Alex Gates, from Evergreen Orthotics and Prosthetics in Washington, and Ashley and Sam, and went to the Hill and had a number of different meetings with members of Congress. And as part of that, not only were we able to chat about Hannah's story and get some real, helpful advice and connections from members of Congress, but we were also able to tie it back to the Medicare O&P Patient-Centered Care Act through Alex's voice as a prosthetist. And that was really just a transformative experience. And we had such an amazing team. And I think a lot of people think, going to the Hill is something that can be maybe scary or intimidating. But we absolutely had so much fun together. And that's something that I'd love to get across to people is that going to the Hill, coming to the policy forum can be something that's really empowering for yourself and can also be a lot of fun. And it's something that's so empowering to the profession. I know Alex said to us after those days on the Hill that she didn't feel like before she came that she could have a proactive stance in what she could do for O&P and helping part of that voice for the profession. And so that was incredible to hear that kind of statement from her afterwards and from so many people who attended the policy forum as well, that they really felt part of a community that they were proactively trying to change. And just an incredible opportunity with that.
I think the most important message that you all could share for us or help us share at SPS is making sure that folks know that this is accessible work, that they can come to it from any position, from any place, in any organization related to O&P care, and have a place and have a home and be part of something. There is so much work to do. So, thank you so much for giving us the platform, the opportunity, to talk about this with folks in the O&P field.
And I think, Ashley, where you're going with that is you don't have to come to just the AOPA policy forum, right? And you don't even have to just contact them via email or phone. You get in touch with our team and we'll bring you to DC and set up meetings for you any time of year. I mean, as long as, of course, your members of Congress are here. That's the important part. Or invite them to your facility at home. I mean, there's so many ways you can get involved. So, and AOPA is here to help anyone make that happen.
So we will have a link in our show notes for listeners to learn more about the policy forum. But what are some ways today that listeners could get involved in advocacy or, I know going to the policy forum, it's already happened this year. So what would be the top, 3 things you'd tell someone they can do today to kind of get more involved and engaged, know what's going on or who they can talk to or put a bug in someone's ear,
Well, I will say we're all available always as much as possible to individuals to help guide them and give them information about ways that they can get involved. First and foremost, reach out to us, please. If folks haven't already, there is a website called AOPAvotes.org. This allows you to write a letter to your member of Congress and ask for their support of the Medicare O&P Patient-Centered Care Act. If they're already supportive, if they're already a co-sponsor on the bill, it will send them a thank you letter. So it's a great opportunity, right, to say thank you for those that are supportive. And you don't even need to know that. The system will do it automatically for you. So it sets up a great, easy, accessible way to reach out to your member of Congress. It does all the work for you. Again, that's aopavotes.org. It's a great way to start, to get your, your first experience with advocacy work. It's a broad, perspective in terms of, the impact that this profession and this field has on individuals. And so the flip side of that, right, is that we need to know about the relationships that individuals that are operating in this field have. I mean, did you happen to babysit a staffer's kids when you were in middle school? I mean, these are the kinds of things that matter. You wouldn't think they do, but they do. Relationship building is so important to advocacy. And it's also part of the trick of figuring out, what are we building? Where are we going? I mean, this bill is one piece of that puzzle, but we're going to need to be advocating for patient access forever, right? Everybody else is going to be doing it. So how do we build relationships and sustainable environments to continue to promote access? And I think that tracking systems like this are just a tool that we can use. But you all telling us, the community telling us about their relationships is super important. So that's another thing that we would just ask that folks let us know when they've got these relationships, or if they know anyone, or if they've, met with their member of Congress, flag it for us so that we can put it in the system and we can refer back to it and build on it.
And I think it's important too that our members are letting us know where we need to advocate for them. So I'll use a recent example. One of the things that Medicare has recently introduced is a newly expanded prior authorization program for Medicare services. And originally it was just limited to very select prosthetic services over the last 18 months, and they've recently expanded that into now including several knee orthoses and several spinal orthoses, all off the shelf, or pretty much all off the shelf versions of the orthoses, with a couple of exceptions. But one of the things that the staff here at AOPA didn't necessarily even really think about until some of our members came to us and said, hey, this is an issue that's going to impact our ability to provide proper care to our patients, is that what happens when a patient is seen in an emergency room setting on a Saturday night, and they need a brace in order to stabilize their knee or their spine, and they can't leave the facility. They can't leave that emergency room until they are stabilized and it is safe for them to go home. So we were able to actually connect pretty quickly with some really, really influential, high-ranking folks at CMS and say, this is an issue that didn't come across with prosthetics because you had all this lead time and fabrication, etc. And now we have a scenario where we have real-world issues that are going to prevent access to care while patients have to wait 3, 4, 10 days sometimes for Medicare prior authorization. And to their credit, Medicare worked with us, and we had a really open channel of communication. And we came up with a solution together that said, okay, this is how we're going to do this. In a situation where what they called an emergent need for an orthosis that was subject to prior authorization, the patient was going to be able to get the service. They were going to get it when they needed it. That particular claim was not going to be subject to prior authorization as a condition of payment. But the flip side of that was that then that claim, once it was submitted, it would be submitted with a specific modifier, an ST modifier specifically. That claim would then be subject, and it would be pulled out of the claims processing, and it would be subject to 100% prepayment review. So it essentially just shifted the prior authorization decision. Instead of having to occur before delivery, it allowed delivery to allow that patient to be stabilized, but then required that the claim be actually reviewed before any payment was made to protect the Medicare system, like prior authorization is set up to do. So, I mean, that's just an example where the message was sent to us from our members directly that this was a real-world problem that needed a solution. AOPA was then able to take that through our advocacy team, work with the folks at CMS and get a real world solution literally in a matter of weeks. And it's not perfect, but it seems to be working fairly well so far. So I think it's so important that people are sending that message to us and letting us know as their representatives how we can best advocate for their needs.
And I will add that it's a reason that Joe McTurnan is in the role that he's in, right? Because if you all out there in the community had to process all of those pieces of this puzzle yourself and try to get anything done, it can be really challenging, right? It's a lot of, bureaucracy and administrative, work that goes into figuring these things out. And so the AOPA team is really lucky to have someone with the expertise that Joe has in these areas. But it just goes to show also that your voice, the voices of AOPA members and folks in the field matter so much so that Joe knows where to direct his energy and where to advocate. And this is another reason why we wanted to bring the full team on here, is to just showcase that there's so many different folks working to make sure that this all works out, that we can amplify the voices of orthotists, prosthetists, administrators, anyone working, our manufacturer partners, anyone working in the O&P space needs to have a home where they can go and ask for us to do this work. And so we're here for that.
Yeah, absolutely. So as AOPA's new manager of public engagement, I work with Joy on as part of our communications team. And this is one of AOPA's strategic priorities, is to be able to better communicate the importance of orthotic and prosthetic care and really to help raise the profile of our profession. And one of the things kind of early on that we wanted to try out and kind of experiment with was getting more involved on social media and helping to raise the voices of AOPA's members through that. So we've launched a campaign that right now is kind of living solely on social media, but we're finding other ways in the future that we're going to build this out. But it's called We Are O&P, and kind of the best way to describe it at this point is a rally cry really for the profession. And we've seen people adopt this as sharing stories about their times in the clinic with their patients, or a success story of what they were able to help one of their patients do. But really what it came out of was April, which was Limb Loss and Limb Difference Awareness Month. And so throughout the course of that month, we highlighted 16 of our members and the work that they're doing to transform the lives of their patients. And we highlighted individuals from all spectrums within O&P, orthotists, prosthetists, administrators, marketing professionals, researchers, students, residents, every person that makes up this profession, and asked them to share a story that was meaningful to them about how they were able to interact with a person with limb loss or limb difference and the role that they played in really helping to transform their life. And we saw some really incredible engagement with that. Really exciting to be able to share these personal stories. And even afterwards, into the policy forum, we saw people starting to adopt this hashtag, We Are O&P, and use it to share their own stories. And one of them that really stuck out to me just recently, Chris Desjardins, if I'm saying her last name correctly, from manager of a Hanger clinic, shared a story about how her patient came to her and said, you saved my life. And that's something that doesn't often happen within O&P. We're not surgeons necessarily, but really this work is life-changing. And the story that she shared was that this patient came to her and she was able to address a critical issue because of the very time-intensive nature of O&P care, that she was able to identify a secondary condition he had and was able to get him referred and into the emergency room and into seeing a doctor that eventually saved his life. She shared that story with hashtag We Are O&P, and also asked others in the profession to, as a result, to help get the word out about the Medicare O&P Patient-Centered Care Act. And so really what we're excited to do is kind of build on this campaign as a rally cry for the community and to help showcase more of what our members are doing and transforming people's lives.
Well, and that's something we can all do very easily just through social. Yeah, I mean, this isn't I need to visit Washington, D.C. This is, I can spend 5 minutes and go to social media and spread the word. So what is the website again, and how do we follow it on all the different social media?
Yeah, you can follow AOPA on all of our social media channels on Facebook, Instagram, LinkedIn. It's at American_O&P or American O&P. And also the hashtag is We Are O&P. And that's a way for you to share your story, tag us in it. And this is a really amazing opportunity for anyone to be able to just share their story. And I think an important part to think about is, from my perspective as a prosthetic user, we've seen the disability community kind of rise up through the ranks of social media and really been able to take charge and get their stories out there. And it has been so powerful for the community. And now we have to also see our role within the profession as a way to share our stories and get our message out to the community as well. And so there's been a number of individuals that I've started to follow on social media that have actually created specific Instagram accounts to share their O&P journey. And I think we're going to see a lot more of that in the years to come and months to come. But, you don't have to do that necessarily. Just share a story on your own social media, and it will reach the masses by getting out to your own friends and family. And that is an incredible way that we can engage the public just through our own social networks.
Okay, so Ashley, as our fearless leader over here, is there anything more that you would like to add, and maybe a 2-minute elevator speech of the net effect of everything you guys are doing?
So I think our strength is in the value of the work that we're doing, the results that the patients see, the outcomes that happen after the delivery of the device. That's where we really shine. And all of the things that we've talked about, including the legislation, including the hashtag, including our other communications efforts, it's all part of the same puzzle that we're trying to build to show the community that as healthcare providers, we are providing necessary care to a group of individuals that are disadvantaged in many cases. And so there's so much passion to the work that every clinician I know dedicates themselves to this profession. And I think that our team feels that passion, and we want to match it. And so we're here to be advocates for you all, to help you all become advocates. And that doesn't just have to be about getting legislation passed. It's about raising your voice. It's about showcasing the work that you're doing for your patients. And it's about showcasing your patients' successes. And so I think it all goes together, and it's important to make sure that we're building that puzzle with every piece. And everybody that's listening to this podcast is part of that.
Well said. Thank you so much.
If you would like to learn more about AOPA's advocacy efforts, follow the links in our show notes or visit aopanet.org.
That's it for us today, guys. Thank you for listening to the O&P Check-in, an SPS podcast.
Be sure to subscribe to the show on Spotify, Apple Podcasts, Stitcher, or wherever you listen to podcasts.
And help fellow O&P professionals find us by rating and reviewing the show.
Yes, we would like to hear from you directly as well. So email us with your thoughts and feedback at spspodcast@spsco.com. And we will see you next time.
Bye.